Thanks, Amy! Hey, Dan here, and I'm going to talk about Sister Roy's views of the environment. Sister Callista Roy defines the environment as all of the conditions, circumstances, and influences surrounding and affecting the development and behaviors of the person. It is the changing environment that stimulates a person to make adaptive responses. Roy pays close attention to stimuli and categorizes the various stimuli as focal, contextual, and residual. Stimuli can be defined as any factor that provokes a response, either in a negative or a positive manner. Roy defines focal stimuli as the internal or external stimulus most immediately confronting the human system. For example, the focal stimuli of pain for an oncology patient must be effectively managed in order for the individual to focus on therapy, which is the desired focal stimulus. She goes on to define contextual stimuli as all other stimuli present in the situation that contribute to the effect of the focal stimulus. Contextual stimuli are all the environmental factors that present to the person from within or without, but are not the center of the person's attention or energy. An example of a contextual stimuli could be hunger or a loud therapy environment that may distract a patient during their therapy. Roy then defines residual stimuli as all environmental factors within or without the human system with effects in the current situation that are unclear. An example of this for the oncology patient previously discussed could be recalling a relative's difficult experience with cancer, causing the patient anxiety without the patient making the association between the two phenomena and how it is affecting the current situation. These three types of stimuli combine to create the person's adaptation level. We'll now go to Carly. Okay, Carly, your turn!
Thanks, Dan! Many different people have a variety of different views as to what health is. There is no consistent view of health. However, it can be agreed upon that understanding the complex nature of health continues to evolve with us. One of the most widely accepted definitions of health is defined by the World Health Organization as a state of complete physical, mental, and social well-being, and not merely the absence of disease. Health is not the freedom of death, disease, stress, or unhappiness, but the ability to cope with them in a competent way. Humans can be described as adaptive systems, constantly growing and developing to fit within their changing environments. Health can be described as a reflection of this interaction or adaptation. Adaptation to one's environment can be viewed positively because it helps promote survival, growth, mastery, and person and environmental transformation. Adaptive response is said to promote integrity or wholeness relative to these goals and the purposefulness of human existence. The purpose in life is reflected in becoming integrated and whole. Therefore, the adaptation model defines health as a state and a process of being and becoming an integrated and whole human being. Now off to you, Heather.
Thanks, Carly! Roy defines nursing as the science and practice that expands adaptive abilities and enhances person and environmental transformation. Nursing coincides with the physiological adaptive model by assessing the internal and external environment as a means of establishing an etiology, host, agent, and environment. The nursing care plan is devised through the means of nursing diagnosis, and which consists of the assessment and intervention mechanisms as a way for the client to adapt to stressors, thus implementing the Roy adaptation model. This nursing care plan is a way to cope with the stimulus that affect the client's health as a way of achieving adaptive behavior in hopes of either achieving health maintenance or health restoration. Nursing works with clients by using their practical and theoretical knowledge, thus helping the client gain a better understanding about their health so they can help the community as well. It helps alter negative stimulus impacting health through nursing care measures such as helping clients seek active behaviors like the North Bay District Health Unit uses various means of teaching, immunization, and walking clinics. And it helps promote health, therefore transforming the client through the practical means of education. And now I'll pass it off to Michelle.
Thanks, Heather! So how does Roy explain how a person adapts? Well, she says that in her adaptation model that there are 4 different adaptation modes, and they each have a description and a basic need. So the first one is the physiological and physical mode. This is responsible for 5 physiological basic needs: oxygenation, nutrition, elimination, activity and rest, and protection. The 4 complex processes that contribute to physiological adaptation are fluid, electrolyte and acid-base balance, neurological function, and endocrine function. The physical part of the physiological mode is the way that the adaptive system manifests the adaptation. And its basic need is operating integrity, which means that everything is operating properly. The self-concept group identity mode focuses on the psychological and spiritual aspects of the person. The basic need is psychic and spiritual integrity, which means that the person can exist with a sense of unity, meaning, and purposefulness in the universe. The role function mode focuses on the roles of the person that they occupy in the society. And the basic need here is social integrity, which means knowing who you are in relation to others so you can act accordingly. Now, what kind of roles are there? Well, Roy says that there's primary, secondary, and tertiary roles.